The diversity of the candidate in terms of their interest is obviously the key criteria. The schools are excellent, community is very supportive, the proximity to larger communities is not daunting. Community of over 40,000 people is less than an hour away. It's usually about a 45-minute ride. Community of Wichita, which is a very large metropolitan area in Kansas, is less than 2 hours, and it's an easy drive. So people do tend to have access. Migration in for family and others is relatively easy in terms of air with Kansas City and Wichita. And so therefore I would say that a candidate with a young family would be very well served to join a community such as ours. We're large enough to make the school system, I think, a very well-rounded school system in terms of access to the arts and the athletics as well as the academics. And someone who is more mature in their practice and are looking for an opportunity to come into a small community and to immediately hit the ground running, so to speak, with a continuation of their practice within our community, would be equally as well served to give this a strong consideration. Backsiding our physician recruitment for someone in this capacity is that we also have 2 students at this point that are going through medical school, have started their medical residency, that have been born and bred in Ellsworth, that are hoping to join us. They may have other professional challenges as they complete their residencies, where we may end up sharing them with a larger facility if one of them wants to do OB part-time, as an example. And one is in family practice, one is in internal medicine. So from the standpoint of your background and the things that you are interested in doing, those opportunities are there for the more complex cases as well. Ellsworth has as much, if not more, to offer than most small critical access hospitals and rural facilities. The pieces that we do not have is obstetrics and surgery. With the exception of those services, we provide as full a range of primary care and acute service and swing bed services as any facility. And I would also add that we have a group of community leaders and participants in the governance of the organization that have been, up to this point, wholeheartedly supportive of the directions that we've taken. I just would welcome the opportunity to meet with any qualified candidate and to demonstrate what I feel is an excellent place to establish a career path and provide services to, I think, a very appreciative group of citizens.